The proceeding will start shortly.
I would like to start this evidence session of the International Development Select Committee on the humanitarian situation in Gaza. We're joined with two witnesses today, Dr. Richard Brennan, who's the Regional Emergency Director of the World Health Organization, and Matthew Hollingworth, who's the Country Director for the World Food Programme for Palestine. We were fortunate enough to meet both of you last week when the committee came out to Egypt and Al Arish to get first-hand testimony of exactly what the situation is in Gaza right now. Thank you so much. Matt, I know that you drove 12 hours to get to see and speak to us, so we're very grateful for that. And Matthew, Richard, we've been seeing today the World Health Organization has been putting footage out via the BBC inside hospitals. And can I say to both of you, we always had the deepest admiration for your organisations and your staff, but the conditions that they're working in right now in Gaza are simply, beyond, I haven't got a polite enough word, they're just horrendous, and thank you to them for all that they do to try to support the people of Gaza right now. If I could ask you both really to introduce yourselves, your organisations, and then tell us what you are actually doing in Gaza and when. Matt, could I start with you, please?
So thank you very much, Madam Chair. So yes, my name is Matthew Hollingworth. I'm the Country Director for the World Food Programme in the State of Palestine. I came out of Gaza last Monday afternoon, or late evening, or late afternoon, early evening, and I was there for a week prior to me going up to Egypt. And then before that, because I'm based in Jerusalem, I was here, then I've been in Gaza before for 10 days a week earlier. The World Food Programme in Gaza today is providing, emergency food assistance and nutrition assistance to approximately 1.3 to 1.4 million people each month. And with the United Nations Relief and Works Agency for Palestine Refugees, we are the two largest organisations providing food assistance, in particular, in the Strip. And we have an agreement in terms of our division of labour on whom we provide assistance to.
Thank you very much. Rick, could I ask you the same question?
Yeah, thanks very much. My name's Dr. Rick Brennan. I'm the Regional Emergency Director for the World Health Organization in the Eastern Mediterranean, based in Cairo. So our region covers 22 countries. We have some of the largest and most complex humanitarian emergencies in the world, from Gaza, of course, to Sudan currently, Somalia, and Syria, Lebanon, Afghanistan, Yemen, and so on. So we always have our hands full, and no more than today, with the two truly catastrophic crises in both Gaza and Sudan, in fact. And I'm actually here for a two-day meeting. I'm here in Doha on a two-day meeting on Afghanistan, which is another story altogether. So my role with respect to Gaza is I oversee WHO's what we call technical and operational support for our response inside Gaza. So I bring together the resources from right across the organization to support our operation. I've only spent 48 hours inside Gaza since the start of the war, and that was 2 weeks ago. But I'm in daily contact with our team there. And what I saw in my 2 days on the ground, it just confirmed everything you've seen, thought, heard about the desperate situation in Gaza. And like you, Madam Chair, I think we find it hard to come up with the appropriate adjectives. Like Matthew, I'm a humanitarian veteran. I've been in this field for 31 years. I rarely use the term catastrophic. We've been using it with respect to Gaza since November. Don't know what's after catastrophic. Ambassador Satterfield, at a meeting with us 3 weeks ago, described the situation as beyond catastrophic. So again, I think we are all pushed to come up with words and descriptions that can really convey the gravity of the situation from the humanitarian and public health and other perspectives.
Rick, I don't want to know what comes beyond catastrophic because I just don't want us to get there. Can I hand to my colleague, Chris Law?
Thank you, Chair. I wanted to explore that a bit more because there'll be many people watching this from outside this room as well as us gathering evidence here. But when you talk about catastrophic, and I know that both of you have been to many locations, different parts of the world, can you give some examples what that looks like? Maybe start with yourself, Matt.
So, I mean, I have to say, as Rick was saying, I've worked for the World Food Programme now for 23 years and have served in many of the countries he mentioned, including Afghanistan and Yemen and Syria and Sudan and South Sudan, etc. And I've seen firsthand what famine looks like. I've seen firsthand, what starvation really means and what it does to communities. I think the key issue today in Gaza is that it is 100% man-made. And it is something that has happened in 4 months. So the speed in which the situation has deteriorated in the Gaza Strip, I don't think I've ever seen. I worked in Gaza City 25 years ago. I was in Gaza City a week last Sunday, and it looks nothing like it once did. 75% of it is destroyed. If it's not, not entirely destroyed, it's extraordinarily badly damaged. The roads are all torn up. The tarmac is torn up. The water pipes are torn up. The sewage pipes are torn up. There is, rubbish rotting everywhere. There's a smell of death in buildings, from buildings. There's a stench of excrement in the air. It's dusty, it stinks, and it is overpowering. And it's where 300,000 people live and are trapped and can hardly move. And it's under bombardment every day. And you listen, you wake up to the sound of drones, and you go to sleep listening to the sound of drones. It's hell on earth, to be honest with you. And so I've seen horrible situations around the world because of natural disasters. I've seen the terrible things that man can do to man and the impact of war. But what you see in Gaza is something that has happened so quickly, is so devastating. And to most of the Gazans that I have met, so bewildering because it's been so destructive. I mean, 1 in 100 have died in this war, almost getting to the point of reports that 30,000 have been killed during this war, notwithstanding the Israelis, 1,200 more that were killed on the 7th of October. So, the sheer death and toll to both communities, but in Gaza in particular, people are shattered. You meet walking zombies in Gaza City because people just can't believe that the situation they're living under. And we use the word catastrophic in the food security world to describe famine, when people miss not meals but days without eating, where their health deteriorates, and where in relation to that hunger, the merest of illnesses can be fatal. And that's the level of catastrophic hunger you're starting to see in places like Gaza City. And this was forewarned in December when we completed the integrated phase classification survey. And the experts from around the world made that case that if we didn't do something, and we didn't do something in terms of significant volumes consistently provided to people in that area, then some 500,000 people were at risk of starvation. And we haven't been able to respond consistently and with the volumes that it would take to ensure that food is there. And so, catastrophic is a difficult word to understand, but when you break it down scientifically, it's very clear. People will die, have already started to die of hunger-related illnesses. Children, old people, the most vulnerable, people who are already compromised with illness, with chronic illness, and it's happening.
Matt, I wonder, famine is a technical term. I wonder if you can describe what that looks like and when that definition comes in. I think there's 4 stages before you get to famine, but can you just talk us through that a little bit?
So we talk about levels of food insecurity in terms of stages. Yes. So by the time you are at famine-like conditions, risk of famine, and famine itself, you are at catastrophic levels of food insecurity. I will send to you the last integrated phase classification survey, which explains where we were in December.
Thank you.
In terms of the understanding from the analysis at that time. We are starting with austere organizations like the World Health Organization, the Food and Agricultural Organization, UNICEF, and many more to collect the data right now to update that survey, which will be out again in March. But essentially, as I said, you start to talk about catastrophic food insecurity when people are missing days of food, where they are ill and sickness is caused because of that lack of nutrition. It is beyond the slow decline of health because of a slow decline on the amount of food available. It's when it's acute. It's when it's beyond crisis levels. It's beyond emergency levels. And that is indeed the situation that the 300,000 people living in Gaza City in the north and around 200,000 more in the middle area up to the north, that's the situation they face today.
Can I ask, you've talked about the intensity and the fact that people are trapped and can't get out, and you've never seen anything like this before. Is this, often we hear that, the operations in Gaza are precise and targeted towards Hamas. What's your experience, what you see on the ground? And if I could follow up on that, have you seen acts that you've described as clearly in breach of international humanitarian law?
I mean, there's no question that there are 21st century weaponry in use that are extraordinarily precise, but there's also weaponry that has been in use for the last 200 years. Shell fire, mortars, bullets, grenades that are anything but precise. They are, they are no question having an impact on the general citizenry of the Gaza Strip. So while indeed there are precise weapons used, it is predominantly a blunt force, battlefield, and that's the reality. We have, I have seen large numbers of civilians hit, and again, one could argue, or it would be argued, that people are collateral, that they're in the wrong place at the wrong time. But bottom line, the violence is everywhere. There is nowhere safe across the entirety of the Gaza Strip. It is a total war, and that is what we're seeing. And the entire population is frightened and jaded and scared and is, bewildered because of the level. In terms of international humanitarian law, there is no question it is being tested as much as it's been ever tested anywhere in the world in terms of what we can and can't negotiate, how fast it takes us to have access to people, not just the timeliness, the ability for us to go and deliver where we must and we demand to go and deliver. We are, constantly frustrated because of a lack of coordination, i.e. a lack of approval to move into areas. We are frustrated because we frequently don't get the approvals when we need them to get. I've talked to you face to face about the sheer crisis in terms of the law and order epidemic across the Strip. If we do not receive clearances to go outside of hours when roads are congested and people are around, then criminals opportunistically will take aim. It is Hobbesian in the Gaza Strip right now. It is a survival of the fittest situation because people are so desperate, but criminal gangs are starting to take over. And we are approaching that point where it is almost at the level of anarchy in parts of the Gaza Strip. And that, if you marry that with the fact that we don't get clearances when we need them, we are forced to wait with our convoys in areas without getting into places that are the most vulnerable, there's no question that international humanitarian law, as I said, is being tested to breaking point.
Okay, and Rick, do you want to add to that, particularly on the issue of clearances? Has that become worse over the last 4 or 5 months in your experience as well?
Clearances, facilitation of missions, do you mean?
Yes, exactly.
But I would say over the last few days, we have had facilitated missions over the last week and a half to Al Nasser Hospital and Al Amal Hospital. But in terms of access to the north, as I understand it, I've just got some data here of the 77 missions requested by the UN to the north between the 1st of January and the 12th of February. Of those, 12 were facilitated, 3 were partially facilitated, 39 were denied, 14 were impeded, and 9 were postponed. But if I may, you asked us to sort of elaborate. Perhaps I can throw some figures, some data behind our more qualitative description of the situation. So, as you're aware, 1.9 million people forcibly displaced in a very, very small geographic area. And again, having been in this business for 31 years, I've never seen that level of displacement. The only thing that could come remotely close would be the Rohingya, in such a short period of time I'm talking about. The only thing that could come even remotely close in such a short period would be the Rohingya crisis, and it was less than half that number. Matthew mentioned that there's been almost 30,000 traumatic deaths since the start of the conflict. Now, we estimate 65% of those deaths are amongst women and children. That is the inverse of what you would expect in a normal war. It's indeed the inverse of what we saw in the conflicts in 2008, 2014, where you would expect the majority of deaths to be of men of fighting age. But here we have the majority of deaths amongst women and children. There are also close to 70,000 injuries, and these are not just broken bones. These are complex war injuries, penetrating injuries to the head, to the chest, spinal injuries, burns, amputations, multiple injuries. That data has been questioned. Important to point out in several quarters, because it does come from the Ministry of Health, but it's important to point out that 3 different academic institutions have looked at the data and they think it's reasonable estimates. It's been validated. In addition to that, like associated with that massive level of displacement, of course, comes the terrible overcrowding, the lack of access to water and sanitation. So we've got established disease outbreaks of diarrhea and hepatitis, terrible soaring rates of skin infections and childhood infections such as chickenpox and so on. And that situation could certainly worse, and we certainly expect it to worse. Matt's talked about the food crisis. Now in northern Gaza, over 15.5% of kids under the age of 2 now are acutely malnourished. Prior to the conflict, less than 1% of kids under the age of 5 across Gaza were malnourished. So we're starting to see this rates of acute malnutrition, really skyrocket. In that context, with these soaring needs, we've seen this massive and acute degradation of the health system. So prior to the conflict, there were 36 public hospitals functional in Gaza. Today, there are 12 hospitals functioning, and they're only partially functioning. They're only minimally functioning. You can take Al Nasser Hospital, the second biggest hospital, off the table right now because its functioning has been massively degraded following the siege of the last couple of weeks. And only 7 of 23 UNRWA clinics are functioning. In addition, colleagues, two leading professors from the London School of Hygiene and Tropical Medicine and from Johns Hopkins University have just done some modelling and some projections about potential death rates based on scenarios of whether there's an escalation in the conflict or whether we have status quo, whether we have a ceasefire, and whether there are epidemics or not. Worst case scenario, they're talking about another 85 to 86,000 excess deaths due to trauma, untreated infectious diseases, untreated chronic diseases, and so on over the next 6 months. So that would just be an issue that is unimaginable. And that's something that we can prevent, of course. All of those deaths would be preventable if the right political action was taken.
And Rick, just on that point on the data you're talking about, you've talked about worst case scenario. Under an immediate ceasefire, what's the best case scenario?
If there's an immediate ceasefire and there's no disease outbreaks, there'd be about 6,500 excess deaths. Wow. If there's an immediate ceasefire and outbreaks, probably around 11,500 excess deaths. And if it's status quo, around 58 to 65,000 deaths.
Oh. Thank you.
Wow, that's pretty stark. Thank you. Virendra.
Matt, is it safe for your organization to operate in Gaza?
As you know, we are currently trying to work through a temporary pause of deliveries into northern Gaza, into Gaza City, since my team last were able to get a convoy in, which was not this Monday, but the Monday before, so a little bit more than a week ago. And the reason we paused after those deliveries was twofold. First of all, 2 consecutive days, we took convoy of 10 trucks of food into Gaza City. 2 days in a row, when we crossed into Gaza City, thousands, tens of thousands of people swarmed forward, desperately trying to get their hands on the assistance that we were bringing in. Because they came too close to the checkpoint, the tank opened fire on them, killing some, hitting my vehicle on the Sunday, because again, they were just too close. And even with that situation, with a light machine gun firing in their direction, people still continue to run forward. Now, I don't know, I can't imagine how hungry you must be, or how hungry or sick your family must be for you to be willing to continue running in waves into machine gun fire for a box of food. So I think when you see the risks that people are willing to take just to get a bag of flour or a box of food, it behooves it on us to continue to try and support. But we also have to take decisions, tough decisions, to try and make sure that the people we serve are not put into further danger than they're not already living in when we are providing them aid. That's the primary reason why we stopped deliveries to Gaza City. The secondary reason why we stopped is because on the second day, our teams came under at least 5 or if not 6 waves of attempted looting, violent by criminal gangs who were tipped off that we were going to be trying to get assistance again into Gaza City, beat up our drivers, threatened our people, smashed our trucks, and indeed ended up stealing about 40% of what we desperately needed to get into Gaza City. So, in answer to your question, it isn't safe. It's a war zone. Front lines are constantly changing, battlefields are changing. There's use of rockets, missiles, mortars, and shell fire. And you add to that, as I said, an approaching anarchy-like situation, because the state that existed has been degraded. There aren't police on the streets to bring civil order. The ones who are on the streets are the bullies who are opportunistically filling that space. So it is a concern. We do everything in our power to mitigate those concerns. We use armored vehicles to move around. We negotiate and notify everywhere we are going. And we maintain communication internally, although that is frequently difficult because a lot of communication equipment is not allowed into the Strip. So it isn't the safest place to be, but we are fully aware of that. And we put every measure in place to operate safely. But like I've said already, there's nowhere completely safe inside the Gaza Strip today.
Rick, same question.
If I may, just to add to that, so I think Matthew's described it extremely well. Maybe again putting some data to it. There's been over 150 UN staff killed since the start of the conflict, including a WHO staff member, one of a 27-year-old national staff member who was running our limb reconstruction project. She was killed together with her 6-month-old son, her husband, and around 50 members of her family. They were taking shelter in her father's house. They'd have been displaced. In addition, there's been over 120 journalists killed. Philip Lazzarini from UNRWA has come out saying there's been more UN staff, more journalists, more medical personnel killed in this conflict since in the last 4 or 5 months than any other since the UN was founded.
Yeah.
Hi Rick, hi Matt, lovely to see you again. I just wanted to come in on Virendra's question. Rick, can you describe how the WHO member and her 6-month-old and her family died, please?
So she was displaced she and her husband and infant were displaced from northern Gaza, and she took refuge in the home of her father, together with around 50 members of the extended family. And as I understand it, that home was struck in an aerial attack, and again, 51 members of one family killed. There are numerous examples that are similar. When I was in Gaza the other day, one of our drivers, he told me of 3 of his siblings who'd been killed together with their entire families, their wives, their spouses and kids. So that was 19 killed from his family in separate attacks. And he has now established a tented facility next to the main WHO house in southern Gaza, where he is now accommodating 47 of his extended family. Because, as I understand it, he's one of only 1 or 2 in the entire family that have gainful employment right now. So he's providing that type of accommodation. But there are numerous examples of entire families being killed during the conflict.
Thank you.
Matt, you did mention about the food situation in Gaza and very close or already in the stage of famine in that area. But you also said that you were there about 25 years ago. If you have to compare that then the situation of people's own fruit and vegetables growing and now, and secondly, that addition to this is that is there any food being produced in Gaza at this stage?
I think, again, prior to this crisis, Gaza was a very significant producer of its own food. Fresh vegetables, fresh fruit, chicken, meat, eggs. There were issues in Gaza that were poverty related in terms of food insecurity, but production-wise, food availability-wise, it was actually doing well. And what you've seen is a very significant deterioration on the amount of land which is available and safe to farm, the harvest that has been lost, animals that have been killed, fodder that is no longer available, so animals that are either being killed because they can't be fed or have already perished. So the food producing capacity of the Gaza Strip has been decimated. And when it comes to cattle, sheep, goats, chickens, replacing them and rebuilding that stock is something that will take many, 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 many years to replace. So when you look at their ability now to produce the food they need, it is absolutely severely curtailed. And they are, to a greater extent, entirely dependent on aid in kind because of the lack of significant amounts of local production. You do still see in areas where there hasn't been as active ground fighting, areas where the greenhouses still stand, the fresh vegetables, tomatoes, cucumbers are still grown and are available. But it's in those areas that have yet to be included in the ground warfare. So that can change. We hope it doesn't. We hope, for example, the Rafah incursion does not take place. But for example, in Rafah, a lot of the fresh vegetables that are available are still grown in those greenhouses. It's not the same elsewhere. The entire time I was in Gaza City, I only saw some, essentially spices were still for sale because they still had them in stock. People weren't buying them. Some dried nuts were for sale, and citrus fruit was for sale because some of the citrus farms were still accessible. But very little else. Certainly no, mainstays of diets. No wheat flour, no bread, no lentils, no rice. Very little. And it's shocking when you look and you refer back to what markets looked like 5 months ago.
Thank you very much. Thank you, Matt.
Thank you. Matt, just to try and give some context to this, the committee went up to Al Arish and met the amazing volunteers of the Egyptian Red Crescent who are coordinating all the aid getting in. I mean, they were phenomenal. On the 17th of February, only 4 truckloads of aid got in. And that was, from what we can understand, because of all the red tape that the Israeli government is putting around goods getting in and out. For where the World Food Programme has worked in hunger situations around the world and thinking of, for example, a refugee camp, what numbers, and I know trucks are not an ideal metric, but it's the only one I've got, what numbers of trucks would you be seeing in a similar food shortage situation going into a refugee camp in the past? Just for us to get an idea of whether 4 is adequate or not.
We need to be seeing 500 trucks going into Gaza at the moment to make a difference. Yes, I mean, to make a difference, because, and you're talking about food needs, water sanitation, hygiene needs, shelter needs, medicine needs, and other health materials. Those are the 4 critical areas that we know must be switched on in terms of the delivery if we're going to make a big difference to people's lives right now. Gaza City alone, we need to be seeing 60 trucks going in every single day. The original plans called for, between UNRWA and WFP, to be sending 30 trucks each per day over a month in order to essentially make a change to the food situation. And that's just Gaza City. So we're seeing a drop in the ocean. A lot of that is down to the violence in the corridor between Nitzana and Kerem Shalom and the Rafah gate. It's down to some of the protests we've seen. Today the gates aren't open because there's an election in Israel, and everything is off for the day. But we need a vast increase in the amount of assistance going in. But to do that also, we need to see other corridors. I mean, it's crazy at this moment that we only have a southern corridor to bring humanitarian materials and commercial materials into Gaza Strip. You know, we need other entry points for both aid and trade to enter Gaza if we're going to see markets, improve. If you look at the price of flour today in Rafah, it is 979% higher. 979% higher than it was pre-crisis. Vegetable oil is 198% higher. Salt is 467% higher. So when you and Rafah, in comparison to Deir el-Balah and Muscat and Khan Yunis and certainly Gaza City, at least is next to the crossing where assistance and trade comes through. It's far worse in Gaza City. So we need a much greater number of trucks coming in, but I would challenge and say we need a much greater number coming in, both aid and trade, and we need them coming in from multiple directions. Because again, to get to Gaza City in the north from Rafah is extraordinarily difficult. It can't be made easier. It's all about political decision to enable it.
Why is it difficult?
At the moment, the politics in Israel post 7th of October are such that there is a strong view from the population not to have aid go directly from Israel into the Gaza Strip. And hence all aid is going from Egypt, either from Egypt to Kerem Shalom or from Egypt through Nitzana, in order to then end up in the Rafah crossing and enter the Gaza Strip.
Thank you. Rosanna.
Thank you. A lot of what I was going to ask has been covered, so I will tailor my questions slightly to get some further information. Matt, would it be fair to say that Israel is prohibiting food getting into Gaza?
I think what we need to see is more food getting in. If it's a question of Israel stopping all food going in, it isn't. Are we seeing enough going in? Are we seeing every opportunity to see assistance go in, including food? Are we seeing every corridor and entry point being open to enable food in? The answer is no to all those questions. So we need to see more. We need to see it consistently going in, and we need to see it going in at every single possible entry point if we are going to turn this crisis around. That's a political decision. It's for Israel to assist in allowing us to have that access.
And as you stated to us in Egypt, and you've said already today, if I may paraphrase, and please feel free to correct me, what you have said is that you have made that case to Israel and they have not been forthcoming to allow the proportion of food in that is required to feed people in the Gaza Strip.
We need a lot more to get in, particularly to the north, if we're going to stop a famine in its tracks. Right now, we are not able to do that.
And you've made that case?
Absolutely, and continue to make it publicly every day.
And you do it very well, thank you. Rick, I know that in Egypt we spoke about, and you have again today very articulately spoken about the impact of the ongoing crisis and the number of excess deaths. Can you just, for the benefit of those that didn't have 3 hours of your company, talk a bit more about those with chronic or ongoing conditions such as cancer or diabetes, those who actually require dialysis, things that would be ordinarily quite easy to come by when Gaza was operating, even though not in the full capacity that we would enjoy. But can you talk a little bit about that?
Yeah, I think, thanks for the question. So important to note that prior to the conflict, Gaza, with all the constraints that it existed under with essentially the blockade, actually had a pretty good health system and pretty good health outcomes. So if you look at the 22 countries across our region, when you look at the main health indicators, they were probably pretty middle range. So given the circumstances, they did quite well and had a solid response to the COVID pandemic, for example. And the major cause of death in Gaza prior to the conflict was exactly what you're saying, the chronic diseases, heart disease, strokes, diabetes, cancer, and so on. So this major disruption to the functioning of the health system puts the people who've been treated for chronic diseases at enormous risk of complications and death from those diseases, particularly the dialysis patients, particularly the cancer patients. Now, we haven't been able to put together a comprehensive enough strategy to target those people because they're on the move. Clinics are working one day and then they're not the next day. Hospitals aren't functioning and so on. So it's absolutely vital, as you say, that we keep those truly life-saving interventions for chronic disease going. Dialysis is an example. I was in Al Najah Hospital the other day where they have a dialysis unit. That dialysis unit was working 24 hours a day. Unfortunately, most patients could only get a 2-hour session twice a week. Now, to put that in perspective, most dialysis patients, my brother-in-law has had 4 kidney transplants. He's back on kidney dialysis. He gets very sick if he doesn't get his 3 treatments for 4 hours a week. So we went into that dialysis center, absolutely heroic what those doctors are doing. But we know people are dying. We don't have good data. We know people are dying because they don't have adequate access to the dialysis, to their insulin, to their cancer treatment. Again, up in Al Shifa Hospital, which has been in the news a lot, up in northern Gaza, one of the main departments of the hospital that somehow they've been able to keep going is dialysis, but we haven't been able to get supplies up there recently. So this modeling that Johns Hopkins University and the London School are doing is really trying to work out how many people will die for untreated diabetes, high blood pressure, cancer care. We have, with a number of partners, and WHO hasn't taken a lead on this, but we have been able to facilitate it, evacuated several hundred cancer patients. They've gone to countries like Turkey and Egypt and Emirates. But it's a very, very difficult situation to get those types of treatments to people with chronic diseases at this stage. And we know people are dying because of the lack of that treatment.
Thank you so much. And I know that as well as hearing from yourselves and meeting yourselves, we met with many others in Egypt as well, who were working as heads of other NGOs. They spoke of the fact that there are now a tiny fraction of hospitals and medical centres working in comparison to previously. Rick, can I ask you very honestly, have you seen and heard accounts of hospitals and healthcare facilities being targeted?
So we certainly we have heard numerous reports of military action that has impacted hospitals and clinics. Absolutely. So, for example, our team was in Al Amal Hospital just a couple of days ago. Over the few days before they entered, the hospital was hit approximately 8 times by military fire. When they went to Al Nasser Hospital, you may have seen some of the videos, extensive destruction in Al Nasser Hospital. And there are other examples online of hospitals and other health facilities being struck. I might just add, it's not just, and WHO has documented over 380 attacks on hospitals and clinics and healthcare more generally in Gaza. For example, when the team visited Al Amal Hospital the other day, none of the ambulances were functioning due to a combination of damage and lack of fuel and maintenance and so on. But this massive degradation of the health system, if you look at the number of hospitals functioning, most of the main hospitals prior to the war were in northern Gaza and middle Gaza, the middle region. In southern Gaza, in Rafah, there were only 3 public hospitals functioning. Together, they had about 200 beds. Now, this is where we know now that over 1 million people have been displaced, and this is where we know that the next military offensive by the IDF is being planned. So you've got 3 hospitals, together around 200 beds. Now, there have been 2 field hospitals established, one by the Emiratis with about 200 beds and one by International Medical Corps with about 100 beds. Al-Najah Hospital, prior to the war, had 65 beds. Right now, it has 300 beds. Completely overwhelmed. I really don't think I've seen a situation like that, and I know it's not the worst hospital. Now, when we visited Al-Najah Hospital in Rafah and the IMC Hospital in Rafah, they were preparing for the expected military offensive into Rafah. And they were doing 2 things. One was they were planning to refer their patients out to other facilities. Now, I've just told you that prior to the conflict, there are only 3 hospitals in Rafah. They've got to find other places for these patients to go. And there are only 12 hospitals, partially functioning across the whole area. So they're just going to try, they'll probably discharge patients too early. They're going to try and they will end up overloading other hospitals because they're going to be in the firing line if this offensive starts. Secondly, they are also looking at relocating to other areas of Rafah, further west in Mawasi or perhaps a little bit north of that. So if they have to discharge patients and transfer them, those patients will clearly suffer. Whatever existing hospitals continue to function will be even further overwhelmed. And if they then try to relocate, they'll be out of action for another 3 or 4 days in the middle of a military offensive where we will know that trauma cases will soar. So it is absolutely a desperate situation. The other point I would add that I think it's important for this committee to be aware, and I'm conscious that time is almost up. UNRWA was the largest provider of healthcare across Gaza, and I know also an important partner with WFP, and Matt knows UNRWA well, where every humanitarian agency is gravely concerned about the defunding of UNRWA. We have to be honest. WHO and the health sector will not be able, we're the second biggest actor in health in Gaza. There's no chance we'll be able to compensate for gaps left by a defunding of UNRWA. That will just, we've already grappled to find the right words to describe the humanitarian situation in Gaza. So if UNRWA is taken out of action, God help us all. Perhaps the final point I might make is that, like Matt, I do want to acknowledge the suffering the Israeli people went through on October the 7th. Nothing that we have said today diminishes from that suffering. But it's very, very, very important that you understand the gravity of the situation right now and how we are in a downward spiral that if we make the right choices, we can avert. Thanks very much.
Thank you. And absolutely noted your point about the 7th of October, a sentiment that we all absolutely share, and that is always on the record. And thank you for re-establishing that fact again today for the second time. I know Matt said it already. Just have a couple more questions. I will try to be brief. We've heard about journalists who have been killed, a disproportionate number of journalists compared to any other conflict. We have heard about the over 150 UN staff have been killed, and we have heard about the disproportionate number of medical staff that have been killed. You've lost some of your own, I know that, Rick. Do either of you, and I'll start with Rick and then Matt, you can come in, please. Are either of you aware of targeted attacks on healthcare workers?
So WHO, we have a system, our surveillance system for attacks on healthcare. So we have documented over 380 attacks on healthcare. It is not within our mandate or our level of expertise to say whether a specific attack is targeted or to determine who the perpetrator is. Mm-hmm. What we can tell you is that the attacks occurred. It's not our mandate to apportion blame or to determine whether it's a deliberate event.
Absolutely understood. Can I ask you how it compares to other areas you have worked in as a WHO?
It's completely, largely out of proportion. I think that perhaps in the early stages of the Ukraine crisis, there were a lot of attacks on healthcare as well. But nothing in my direct experiences compares with this in terms of the scale of attacks in the period of time. And I could get you that data to share with you the proportion of attacks the WHO has documented in the 15, 16 countries in which we have the system operating. I know that a significantly disproportionate percentage is occurring in the occupied Palestinian territory. We've also documented, I might add, over the last few months, over 300 attacks on healthcare in the West Bank as well. And again, to point out that during the attacks on October the 7th, there were attacks on healthcare inside Israel by Hamas, and deaths during that assault as well.
Just lastly, Matt, you spoke when we were in Egypt. You described something which I've not been able to stop thinking about, and I was wondering, though difficult, if you wouldn't mind telling us again about your experience in Gaza of watching people die in front of you and what that looked like.
Yeah, the event that I described is the events of the first convoy that I was on that managed to succeed in getting into Gaza, which was on Sunday the 18th of February. And that is that point where, as I said, tens of thousands of people just swarmed our trucks. So I was in the last vehicle. People are jumping onto trucks, throwing boxes down. People are catching them and running. They're weak. People are falling over. They can't carry the boxes of food. It's 23 kilos each box, and it's astonishing to see it, and it's astonishing when it is literally tens of thousands of people who are suddenly appearing out of ruined buildings and rubble. But as I said, because they were so close, they were coming right into the area around the Israeli front lines and their checkpoint. The tank fired, and one man was cut down right in front of me with a bullet wound to the abdomen, and one was killed with a chest wound and died immediately. And they were within arm's reach. And what was frightening is people stepped over them and picked up the boxes that they had held and took them. Because I think at this stage, death is so normal in many places, and desperation is normal. And that's a frightening thought for anybody in the world. It's not normal, it's abnormal, it's horrifying. Those poor people will be mourned by their families. But in the hurry to get aid to family members, to friends, to themselves, people just carried on. And what I find strange is that just carrying on, that normalcy around something that is so horrifying and abnormal. I hasten to add, it's very important, we now have systems in place. We have spent a lot of time talking with the Israeli Defense Forces, talking with the people in that area to establish a means to deliver so that people don't panic, so that they don't think the trucks are going away, so that they don't run forward into a frontline area to get aid. They know that there's a safe area where we will drop the assistance and they can go to safely. So we have spent now a week putting that into place. And as soon as we are absolutely confident that that will work, we will start delivering again to Gaza City.
Yes, sorry. Thank you very much. Yes, Rick.
If I may, I've just got some of that data. So since October the 7th,
I'm very sorry. Just before you start, I have to go because I've got to run. But it's been a real pleasure and honour to give evidence before you today. But unfortunately, I do have to run.
We're incredibly grateful that you made this time for us and that you met with us last week as well. And please, please, please express our huge gratitude to all of your staff, all of your volunteers who are doing an amazing job in quite simply untenable circumstances. You've paid tribute to them and you've also given us the testimony that hopefully we can use to try and get this awful situation to stop and keep them safe, as well as the people of Gaza. Thank you very much, Matt. Really appreciate it.
Thank you. God bless. Bye-bye.
Rick, sorry, you were answering Rosanna's question.
Yeah, thanks, Madam Chair. So just since October the 7th, WHO has this surveillance system on attacks on healthcare functioning in around 16 countries. I don't have the exact number in front of me. But we've, over that, since October the 7th, we've documented 977 attacks on healthcare, of which 780 have occurred in the occupied Palestinian territory. That includes Gaza and the West Bank, and that's 80%. Now, I have to, a lot is said about the use of hospitals and medical facilities by Hamas for military purposes, and WHO has documented militarization of health facilities. Our big concern is the way that that finding is being managed. If a health facility is being used for military purposes and is still maintaining its life-saving function, there's very clear principles guiding military engagement with that facility under international humanitarian law. And those principles are proportionality, precaution, and distinction. And we have very significant concerns that those principles are not being consistently applied when health facilities have been allegedly militarized have been addressed. So. If a medical facility is being used for military purposes, for whatever reason, it does not mean that it is open to direct attack. There are principles that guide engagement in that context. And we have very serious concerns about how that engagement has been managed in a number of instances.
Thank you.
Thank you very, very much. Thank you.
David?
Yes, Rick, I mean, you set out the tragic circumstances in which one of your employees was killed, but what's the wider impact on, day to day on people of having to deal with the situation, that they're in? Matt's described a horrific situation that he personally was involved in. What do you think the day-to-day impact on your staff of the situation that they find themselves in is having?
Well, I mean, staff have been devastated. I mean, their losses are enormous. They've lost their homes, they've lost their livelihoods, they've lost loved ones, they've lost their incomes. It was very interesting. When I was in Gaza a couple of weeks ago, I met with our national staff. And it was, as you could well imagine, it was incredibly emotional. And one of the staff, she broke down crying with all those losses. What she highlighted was the loss of dignity.
Yeah.
That, just that they have been, the Gazans feel that they have been dehumanized, forgotten. They feel that international law and international humanitarian law is not being applied to them. They feel that the world is dealing with them with double standards. Because of those losses, I would have to say a large, significant proportion of our staff are certainly not nearly as functional in their day-to-day work as they there might be. They are, all of them have been displaced more than once. And I don't think any of them have their homes to go back to. So their day-to-day existence is about sometimes being on the move, trying to find food, trying to find shelter, trying to find safety for their staff. Now, what we've done as WHO and other UN agencies, we have found shelter for them. We have found some accommodation. But because they have an income, they have broader responsibilities for their extended families. And I mentioned the driver earlier, who's accommodating 47 of his family. So, there's no doubt some of them have such mental health problems with the reactive depression and anxiety that they are not as functional. They're not able to care for their families as much. So in addition to all those losses, there is the constant bombardment. There is the constant fear. And while I was there, I spent most of the time in central and western Rafah. Most of the attacks were in eastern Rafah and Khan Yunis. I heard frequent shelling, and everyone was saying, hey, it's a quiet day. It's a quiet day. None of the shells were near us. So that living in that fear day in and day out, the accumulated stresses are, again, hard for us to describe. I haven't spoken to one staff member who would not leave Gaza if they were given the opportunity.
And in terms of just the structure of how you can operate in those circumstances, I mean, how are instructions or given out? How does it work on a day-to-day basis? Do people follow their own initiative? I put it that way, in terms of what will I do in these circumstances, or are they reporting to a central point? How does it act? How does it operate in the midst of such a chaotic environment?
Yeah. So what the UN and NGO partners have done is we've set up what's called a joint operations center in Rafah. So all the UN and most of the NGO partners, we gathered there in the morning. We'll get a joint update. Now, WHO, like other partners, we have a clear plan. Now, we know what our objectives are. We have 4 main objectives in that plan. And each day, staff within our organisation have specific tasks to deliver on that plan, to ensure the delivery of health services, to ensure that we have a supply line working for the drugs, to set up surveillance to detect diseases and prevent the spread of infectious diseases. And we also play a vital coordination role within the health sector. So the team is structured. We use a best practice for emergency management called the Incident Management System. So we've structured our team around that. So everyone has a particular function, and they're working on various elements of the plan. So we've got the trauma experts working on that. We have the infectious disease expert working on that. We have the coordination expert working on that. It sounds a lot crisper and better organised than it is. Of course, it's a chaotic environment. Our international staff are leading this and coordinating, and they're being very understanding when the national staff are not able to deliver on a given day, for example. But it's as structured, as coordinated as best we can. But as you can imagine, it's an incredibly difficult operating environment, incredibly difficult.
And other committee members have said, but we are very grateful and respectful of what people on the ground are doing, and if there's any opportunity to convey that, then please do so.
Thank you very much.
Thank you. Richard?
Yes, you mentioned the wider situation, including in the West Bank, a little earlier. To what extent has this crisis impacted your ability to deliver in the wider area? We were in the West Bank as a committee 15 months ago, and we met UNRWA. UNRWA obviously has now been defunded. Could you say a bit more about the wider area, and particularly the West Bank?
Yeah, so We do have operations in the West Bank. We still try to maintain our support there for the delivery of health services and similar types of activities. In fact, delivery of health services, delivery of supplies, disease surveillance, disease control, and again that important coordination function. We have limited resources. We have multiple crises to which we are responding across our region. So I would say that there are gaps in what we're able to do in the West Bank right now. In fact, as soon as I get off this call, I've got a call with our country representative in Lebanon. The situation is escalating there, as you may know, now with the first aerial attacks north of Beirut. So we are very concerned about the wider fallout. There are political and security implications not only for Lebanon, but certainly for Syria, for Yemen, as we've all seen with the attacks on commercial shipping in the Red Sea, and indeed in Jordan and Iraq. So when we do our weekly update, we get updates from all those countries, calling in to give us information about the implications of what's happening in Gaza for their countries. And we're watching this very closely. We're doing contingency planning right across the region for all those countries. So it's an increasingly tense situation across the region, particularly for those countries.
To what extent does what's happened to UNRWA make things more difficult for you? We heard both in Egypt last week and also in the West Bank 15 months ago from some of your UN colleagues that UNRWA does things that other agencies do not do. In fact, that it is in some ways more akin to a government. It collects the rubbish. It provides schools as well as providing hospitals. If you defund for reasons that are widely talked about and understood, if you defund what is in effect the government of the area in some ways, how does that affect you as WFP and as WHO? I'm sorry that Matt has gone. How does that affect you as WHO in delivering your services?
Well, we would expect if UNRWA, so UNRWA has 13,000 staff in Gaza. WHO has 30 staff in Gaza. Now, of course, those 13,000 UNRWA staff aren't just health staff, but as you rightly say, they run multiple clinics, they run education in schools, they're running the displaced persons shelters and setting up health posts right now for people who have been displaced. They are the main healthcare provider in Gaza. They're the biggest healthcare provider in Gaza. We don't have the capacity to step, if all of their clinics close tomorrow, and we know over 2/3 of them are non-functioning right now, we don't have the capacity to step in and compensate for those gaps. So what that would translate into, I mean, even after the war, if there is no UNRWA to run those vital social services, it's hard to imagine WHO or other agencies being able to step up and fill the gap, and therefore there would be substantial and sustained gaps in healthcare, education, other, as you say, garbage removal and so on for the foreseeable future. It would be a long-term crisis.
Thank you.
Thank you. And thank you for explaining what UNRWA does. This committee have seen their operations in many countries. We've always been incredibly impressed with the services that they provide. And it pains me very deeply that we have also seen for many years it being used as a political football. It does concern me that of the sort of the 9 principal donors and the EU, that 2 of them, including the UK, have paused their funding. I don't know if the allegations against the UNRWA staff have been proven one way or the other, but that pause in funding, have WHO seen an impact on the ground of that, or is it the conflict and destruction that has caused the the main impact on the services that you're describing?
Yes, I mean, it's really the conflict right now and disruption of supply lines and so on. So I can't say at this stage that we've seen an impact. We will start to see that at the end of March, I believe. I think UNRWA's got funding through to the end of March, as I understand. Maybe just one point to add. Just picking up on a point made earlier, asked earlier about the impact on staff. So we have about 14 UNRWA staff who've been displaced out of Gaza, working in our office in Cairo, and the chief of health there. She's in daily contact with her UNRWA colleagues on the ground who are, delivering these vital health services. She said it's extremely difficult each day to ask them about their activities and what they've been able to achieve, because again, they're fighting for survival for their own families, let alone taking responsibility for the delivery of health services of others. Like you, I've been at UNRWA facilities. They really do heroic work. As I mentioned before, the health outcomes in Gaza prior to the war, very impressive given the circumstances. UNRWA can take a lot of credit for that. In any large organisation, you're always going to have people who do the wrong things, maybe do very, very, very bad things. But the whole organisation for UNRWA should not be tainted for that. And it pains all of us to see the way they are used as a political football and these threats of defunding. It'll have disastrous effects for all of us.
I share your picture of a future without UNRWA, and we just have to try and hope that doesn't happen. Could I ask you, I know that we're eating into your time, but one more question. You've touched on it, but very early on we heard the concerns about the lack of water in Gaza, and that's only got a lot worse. And Matt was describing sort of open sewage, but also about just sort of the lack of water and the consequences of that on health. I wonder if you could describe the situation in relation to water, what that does to a human, and what are the sort of the bare minimums that we ought to be advocating for to keep people alive. I mean, one wishes we could advocate for them to have dignity, but I don't think that's coming in the very near future.
Yeah. So, a minimum standard of water of clean water would be 3 litres per person per day. We estimate right now in Gaza it's 1.8. Probably people are getting 6 to 7 litres in total, including unclean water. The minimum standard is 15 litres of water per person per day, and that's not only for drinking; it's for cooking, it's for personal hygiene, of course. So we're well below international standards. To paint a picture of what it's like in these in the settlements where people are. Again, water and sanitation and living space are absolutely vital. We are nowhere close to, and there are established minimum standards for all these things: food, water, shelter, sanitation, healthcare, international standards. Nowhere close meeting international standards for any of them. I think an important example is on sanitation, where in some of the UNRWA settings now, that they are saying that in the shelters, they estimate 1 latrine per 400 to 500 people. The minimum standard is 1 per 20. Now imagine if you had to share 1 latrine with 20 people, let alone with 400 to 500 people. Again, it's a huge health risk. There is open defecation in a lot of these places. Matt mentioned it earlier, the smell of excrement. And so huge public health risk. And again, there was an article in the New York Times, I think it was, in the last couple of days about this. It's the indignity of it all, the indignity of having to defecate in an open space or trying to find somewhere, or going at night, and that puts young girls at risk trying to, in a darkly lit collective centre with so much overcrowding, and a young girl who's menstruating or wants to, wants to defecate, where does she go? And that puts her at greater risk of sexual abuse and gender-based violence, which is an issue we've hardly touched on. But I'm sure it always happens. It has to be happening. And if you're a father, if you're a mother trying to protect your young daughter in these kind of circumstances, you'd have to be so vigilant in this sort of situation. But it's these practical day-to-day things. A young girl going out to collect water or to go to the bathroom. These are at-risk activities now for young girls and indeed for the whole population.
Rick, thank you. We've heard you. We're intensely grateful that you've come and shared this with us today. I personally hope that the Israeli politicians also hear this and hear what life is like for civilians. This is, if it's a war, it's meant to be against soldiers or against terrorists, not against civilians. And the utter inhumanity of what is happening to civilians is I can't speak about it. I can't cope and stay civil. Thank you for sharing with us. We aim to get a report out on all of this by the end of the week, because the UK government can and must do more, and the Israeli government can and absolutely must do more to protect civilians in this situation. Thank you so much for your time. Order. This committee session is now closed.
Thank you.
Thank you.
The proceeding has ended. 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 The proceeding